Hi, I'm Simon Cataldo, your state representative in the 14th Middlesex District, and this is The Whole Truth on ActonTV. We have a very special guest today. Dr. John Glazer is the attending psychiatrist at Boston Children's Hospital and a lecturer at Harvard Medical School. Dr. Glazer, thank you so much for coming onto the show today.
Thank you for the invitation.
Let's start here, Dr. Glazer. You and I have had the opportunity to get to know each other personally over the last couple of years, and one of the things that I've noted to you and wanted to share with our viewers is that for somebody who is at the top of their field in medicine, for somebody who has achieved so much professionally, you are such a humble and kind and patient person. So I just want to thank you for being that way. That's one of the reasons I wanted to have you on the show to talk about this very, very important topic that we're going to discuss today. So thank you.
Well, you're very kind. I'm pleased to be here.
And Dr. Glazer, in talking about how we were going to do this episode, we talked about good news and bad news, and it turns out that in this field, that's sometimes a little bit difficult to discuss, there is actually quite a bit of good news here in Massachusetts. So maybe we can start there.
Certainly. Certainly, parents have a lot to be concerned about with so much media attention spent on the increase in anxiety, depression, even suicidal feelings and actual suicide deaths in young people. But speaking of that very important central issue, we in Massachusetts should be very proud that of the 50 states, we rank 49th we're 49th lowest in the per capita deaths from youth suicide, second only to New York. And that reflects, I think, many factors, good gun control legislation and regulation, and a state government, frankly, that has been very responsive to providing for the mental health needs of our young people.
And certainly both of those topics you've mentioned have been a major focus in the legislature, in our work. As you know, I have the privilege of serving on the Mental Health, Substance Use, and Recovery Committee in the House that works on those matters. Prior to being elected, there was landmark omnibus legislation relating to mental health care passed and signed into law by Governor Baker, and we're working on more of that now. And certainly on gun control and gun safety, we are the best in the nation in terms of per capita gun deaths, and some of that translates to the suicide issues that you just mentioned. We're now working on a new omnibus gun safety measure in the legislature that I hope is passed this session. Can you talk a little bit more about the dynamic between raising these issues of suicidal ideation, of severe mental health problems in children, and why it's important to have those discussions in a reality where sometimes I think as parents we're worried that if we even talk about these things, that will cause the problem to get worse. Can you talk a little bit about that?
Certainly, there really couldn't be a more important issue than that. Many parents worry that if they're worried about their kids, if their teenager, just to give an example, is starting to withdraw from friends, performance in school is diminishing, connections with the family seem to be compromised, families should be worried. But families often worry that if they translate their concern into having a frank discussion with their teen, that somehow they will plant ideas about the teen harming themselves in one way or another, or even making a suicide attempt. And we know from good science that the more communication, the better. And a frank discussion, if a parent feels that their youngster may be at risk, they should simply ask a neutral question, but one that has the right content. Have you, Johnny, been thinking about hurting yourself? Mom and Dad are here to keep you safe. We're worried about you. And if the answer is no, that's great. But if you're having any such thoughts, we know we can get you help. That will never plant an idea in the head of a teen. In fact, most teens will tell us that they are so relieved and grateful when their parents ask them about that, that's really the thing that parents should do if they're concerned.
And so if the parent gets an answer that's somewhere between maybe and yes, what does the parent do at that point?
You know, there are several resources available to parents everywhere, but there are particular resources available to parents in Massachusetts. So one of the resources that parents often think of, but maybe not sufficiently often, is their youngster's primary care doctor. Particularly if that youngster has had a relationship for a long period of time, which many pediatricians and family physicians do with their child and adolescent patients, who knows that child, that would be my first telephone call, unless they were really concerned that there was an imminent risk. Where there's imminent risk and a parent is concerned that a child might actually cause harm to themselves or someone else, then they should call 911. But most of the time, it's not going to be at that level of severity. Calling the primary care doctor, who will often say, let's have an office visit today or tomorrow, and let's talk about this because I've known your son or daughter for X number of years. If there isn't a long-term relationship with a primary care doctor, or perhaps because it's very difficult nowadays to find primary care physicians, they're in short supply, in the same legislation that you mentioned, there was created a behavioral health crisis line in the Commonwealth of Massachusetts, and I recommend that all parents post that number on their refrigerator or somewhere else that is a place that the family is going to look at a lot. And that number is 833-773-2445. I'll repeat it, 833-773-2445. That's for any resident of Massachusetts, and it's answered 24 hours a day, 7 days a week, 365 days a year, and by professionals who are always equipped to handle any and all concerns in the behavioral health area that a parent might have about their child. Furthermore, depending on what information the parent provides, or the teen who can be on that call or initiate that call themselves, or even a younger child if they are old enough to understand what that means, there is now in that same legislation 25 community behavioral health centers, or CBHCs, that have been established around the state of Massachusetts. And every community in the Commonwealth is connected to one of those centers. And we talk a lot about the problems to access mental health services for young people. These centers are equipped to handle urgent concerns within 1 to 2 days of receiving a referral, and those urgent referrals do not require either Mass Health or commercial insurance.
And Dr. Glazer, so as you know, I represent Acton, Carlisle, Chelmsford, and Concord. There may be other folks watching.
Yes.
And not to quiz you, because we didn't talk about this before, but do you know what community behavioral health centers are in this region closer to us?
There are several, but I have a website that I can direct our viewers to.
Great, and we're going to put that on the screen too, so everyone will be able to see it. But why don't you tell us now?
So one should Google MASS with a capital M, mass.gov space find a CBHC.
Okay.
That will bring up a map of the Commonwealth of Massachusetts with stars at every location, and one should find where one lives, click on that closest star, and the name, location, and phone number of that center will pop right up.
You aced the quiz. That was actually extra credit. You gave more information than I even knew was out there.
Well, it's so
thank you.
important, and before Governor Baker signed that legislation in 2022, we didn't have a system like that.
Yeah.
And it's made such an impact. In fact, the number of kids presenting to the Boston Children's Hospital emergency room in psychiatric crisis has actually diminished, and we don't know for certain, but we believe that these centers have taken the burden off of hospitals. Now, hospitals are critical when there is truly a life-threatening emergency, but for other less urgent problems, an emergency room is not a happy place for a child in crisis to be unless they have to be. So these are alternatives that are very important.
Yes. I have a couple more questions about kind of the front end of this process. And
Certainly.
I want to talk a lot about the back end, which is where some of your practices too. But some things that I think parents my age, I have 3 little kids, as you know, are thinking a lot about. One of which is social media. Can you talk about social media, good, bad? How is it part of this conversation in your view as an expert in the field of psychiatry and child psychology?
Very pleased to talk about social media. Parents don't need me to tell them that this is a subject of very active debate on both sides of the issue. Just recently I witnessed I was watching a television program that had on actually national news on public television, and it had one author of a book called The Anxious Generation, who essentially says that all social media are bad, end of discussion.
Is that Jonathan Haidt?
Yes.
Okay.
Then there was another individual from my institution who said, you know, you really need to take a much more nuanced view than that. And that's Michael Rich, who has a very important presence at Boston Children's Hospital in helping parents deal with these social media issues. As I review the evidence, I believe that these social media platforms can do a great deal of good. For example, children who are members of racial, sexual, or other minorities may find solace in being able to relate to kids that are going through similar kinds of struggles, and peer-to-peer support in childhood and adolescence is extremely important to mental health. So that's a very good use of the platform. Poor uses of the platform are things like cyberbullying, and we know that cyberbullying has a relationship to suicidal ideas and behaviors. And unfortunately, in my practice, I've talked to many teens who have been cyberbullied, and I've seen them after they've made suicide attempts, which they have directly linked to that process in cyberspace. I want to particularly point out the phenomenon of TikTok, which since its inception in 2016 has had over 1 billion hits, mostly by teens. And I want to point parents to a documentary, and they can Google and find this. It's TikTok, boom. So TikTok Boom is a documentary which takes both sides of the TikTok question and I think is enormously informative in guiding parents as to where the benefits and where the pitfalls may be. So TikTok is the platform I worry about the most nowadays.
That's so interesting. I don't use TikTok. I do use other social media platforms, and in my view, as a frequent user of them to try to communicate with constituents and push information out, you can really see the power of the algorithms, and in my view, how those algorithms are specifically designed for pernicious ends in terms of heightening emotion, the way that that information is spread. And when you transpose that onto kids, I think that there's a real risk there. What you're saying about the connection between kids, often connections between kids that might be otherwise hard to reach because they don't live in a community with folks who have similar characteristics, that really resonates as well. So it's so great to hear your opinion and your insight on that.
I would like to add two specific facts about TikTok. One is that it uses facial recognition software, which can actually assess teens' response to certain videos, and then they will pitch videos to that teen based upon the facial expressions that they exhibit. I was shocked to discover that. The other thing that is of great concern that TikTok also can sometimes feed to teens and younger kids sometimes is they will give a psychiatric diagnosis to that teen and say, you have depression.
Wow.
You have borderline personality disorder based on no evidence whatsoever.
Wow.
And I don't think it needs any further commentary from either of us to know how toxic that can be for the viewer.
And I'm sitting here as a legislator thinking, how did they get away with this stuff? I mean, it's terrible.
It's not a very well-regulated platform, and of course there's a lot of political discussion going on at the federal level, but at the moment it's out there and it can certainly do damage.
Yeah. Another question about these issues, kind of the front end of these issues that I'm hearing a lot as a parent in parent circles about, and I think it's starting, this concept is starting to creep in pretty significant ways into mainstream media and mainstream thought, is the concept of bad therapy, of therapy causing rumination, of child psychologists in schools that are causing more harm than good, things like that. Could you comment at all about that line of thought, that way of thinking? How should we as parents, or how do you as a professional think about that theory, that angle on this whole discussion?
I think you may be referring to an article that appeared in the New York Times some time ago that has gotten a lot of attention. And the first thing I would say is that the crisis in child and adolescent mental health is absolutely real. Even before the COVID pandemic, suicide rates, that is deaths from suicide in young people, were increasing. Levels of anxiety and depression were increasing. The pandemic certainly made those trends worse, but there is a crisis. And there's a crisis in there not being enough providers to take care of all the kids that would benefit from mental health support at a professional level. Now, there's a spectrum of quality out there among people who practice. And it's important that parents be well informed. Again, their primary care physician who takes care of their young person is often a very good judge because they've been practicing in that community for a long time and they know who the really good people are. But there is a crisis. We need to address it. We are addressing it in Massachusetts and other places. And and that needs to be very much kept top of mind as far as parents are concerned.
I've been asking you a couple hard questions, and sometimes it can be uncomfortable to do that. You're such a great backstop because you know how to keep all these things in perspective. So thank you for creating that space to be able to ask some hard questions. So let me ask you another hard one that's very open-ended. We've talked about a bunch of different issues. What else do you think parents of kids should be thinking about with respect to this space? Your kids are older now, but what would you tell somebody like me? You don't even know really well my children yet. You probably met a couple of them, but without knowing anything about them, what would you tell me that I should be thinking about in this space?
Well, there's several things that come to mind. I talked about communication earlier, and that cannot be overemphasized. Parents can do things that are remarkably easy to do that can protect their children. One is to communicate, to make sure that the child or teen knows that if they have a concern, that their parents will not judge them, will listen to them, and to do whatever the parent can do to make themselves kind of an open book to their children. Simple things like if a family owns firearms, and many families do, and I'm not taking a moral position one way or the other, but if a family owns firearms, there are safe ways and not so safe ways of securing them. Trigger locks, gun safes that have combination locks, not key locks, because keys can be lost and found. Have ammunition stored elsewhere, just as securely as the firearm is stored. Those are very simple things that families who happen to own those items can do. Keeping pharmaceuticals, medications, prescription medications, over-the-counter medications. Tylenol is an over-the-counter medication that's extremely dangerous when taken in overdose. So secure them if you have children in your household. And don't feel that you're being an alarmist. What you're doing is protecting your children. Another rule of thumb that I typically will guide parents to do is no screens in the bedroom at bedtime. Whether it's a cell phone, a television, an iPad, whatever it might be, screens are very seductive and hard to turn off. And we know that teens particularly aren't getting enough sleep, so that's a good thing to do.
As viewers of this show will know, one of my new pet interests is human circadian health. And the data around that issue is just so robust.
It certainly is.
Do not look at your phone before sleep.
That's exactly right.
It is really powerful. So I'm glad you mentioned that. Dr. Glazer, as I predicted, we are running out of time. I did want to make sure that I ask you before we close if you have any advice for aspiring psychologists or psychiatrists here in the Commonwealth.
I absolutely do. This current time is as exciting a time as there has ever been in the field of child and adolescent and family mental health. The need is great. We will never have enough child psychiatrists, psychologists, social workers, family therapists. The way that our history of the science of mental health and mental illness and the psychology of mental health and mental illness are really coming together in ways that in the past were fought as turf wars, no longer. We need the expertise of neuroscientists, of clinicians, of every stripe that falls under this general category. And I can't encourage young people enough to take seriously exploring careers either in medical school and then specializing in mental health, or in graduate school and getting a PhD or a so-called PsyD degree in psychology, or a degree in social work, or art therapy. There are so many platforms, to use that overused term, that can give expression to this desire to make life better for our young people and our families.
Well, that was inspiring, and I hope it inspires others to follow your career path in some way. I know that you had one other resource to share, and we're going to put it on the screen. It's www.aacap.org/click on families in youth and facts for families. This has been so informative, Dr. Glazer. Thank you for the incredible body of work that you've contributed to this field, and thank you so much for adding to that in a small way by coming on and sharing with this. I'm going to send it to all of my friends, other parents, grandparents. This has been really fun, really great. Thank you so much.
You're very, very welcome. It's been a great pleasure. Thank you for inviting me.
Thanks, Dr. Glazer. That's it for today. You've been with Dr. Glazer, the attending psychiatrist at Boston Children's Hospital and a lecturer at Harvard Medical School. I'm Simon Cataldo, your state rep in the 14th Middlesex District. Thank you to ActonTV for hosting this episode of The Whole Truth.